practice break even. You say that not all doctors know their practice break even.
Absolutely, and I know that can sound really astounding, surprising. However, even the words practice break even, when I use those with a doctor, the question always is, what do you mean? Does that include my compensation? Does that include an associate doctor? So forth and so on. So practice break even, first of all, in its definition, oftentimes is not known. But even more importantly, when you understand practice break even, then it answers a question of where does my money go? And Randy, I had a doctor I worked with, I just started working with him when he went into 30 years of private practice as a general dentist. And in 30 years, his question was, where does my money go? And when we sat down, I did an evaluation and we were looking at the numbers, and I was able to show him where the money went, lined out what his practice overhead. He looked at me, and this is one of those moments that I love what I do. He looked at me and he said, in 30 years, no one's been able to clearly tell me where my money goes. He said, I would look at my profit and loss statement and it would have a number that didn't match what my bank account statement said, or I'd have more demands at home for money and thinking, where is this all going? And all he knew is after 30 years, there just wasn't enough to go around.
What did it do for him, knowing those numbers?
Oh my goodness, knowing those numbers, I watched, as corny as this may sound, almost a relief come over him that he wasn't out of the ordinary. In other words, that he wasn't running a business in a horrible fashion. He just needed to have more attention on those things. So he was more relaxed. And very importantly, he was able to now look at some other directions that he wanted to take the practice. He went into some CE to be able to offer some additional services to patients, which he really enjoys doing. So
now, you told me on another segment that in 24 years of doing this, 25 years of doing this, you've never met anyone, not one doctor, that knows their break even.
Yes, as astounding as that sounds.
And somebody was maybe $3,000 close.
Right, right. And so 3,000 was the closest, but other doctors have been much further off the mark. When you know, as a doctor, as a business owner, when you know your practice break even, you're in the driver's seat.
But if they're science people, these doctors,
yes,
right?
Yes, and they are.
They go, well, that's why I have a CPA. That's why I have an office manager, practice administrator.
You bet.
Should they know the numbers?
Absolutely. However, think about the perspective that those people are looking. You've got to have a CPA. They're looking at things from a tax perspective, where I'm looking at this from the tax perspective must be evaluated by a CPA, but if you don't have enough money going into your account to cover all the expenses that you're writing checks for, you're going to have a problem. Okay. So I'm looking at that from, how do we correct this in the practice? Where a CPA, and
gotcha.
I've heard this before, they've said, you just need to produce more, doctor. But it's, how do I produce more and be profitable in that? That is the question that I help to solve.
And you show them, you show them how.
Absolutely.
And you have story after story, and we're going to have to take a break, but where you have helped people turn this around.
Absolutely.
I mean, that's what you do.
Yes,
so I'm clear.
That's what I do. That's all that I do. So I consult only in dentistry. That's my expertise. And I want to go back to something you said. Doctor has a CPA, office manager, practice administrator. I also work with office managers, practice administrators, because oftentimes they're charged with the responsibility of increase the profitability, make sure all the bills are paid. I don't want to know about that, but they're not sure how to do that. Okay. So I work with them as well.